Welcome to today's video lecture on the nursing care plan for peptic ulcers. Before we start, don't forget to check out our website madeformedical.com for hundreds of more videos like this at the end of this video. The link is in the description. In this session, we will discuss the essential components of a comprehensive nursing care plan for patients with peptic ulcers. I'm Deborah, a registered nurse, and I'll be your guide throughout this lecture. As a nurse, having a comprehensive understanding of peptic ulcers is essential. Peptic ulcer disease refers to the development of open sores or ulcers in the lining of the stomach, also called gastric ulcer, or the upper part of the small intestine, known as duodenal ulcer. These ulcers can cause varying degrees of discomfort and can lead to complications if left untreated. The primary causes of peptic ulcers include Helicobacter pylori or H. pylori infection, NSAIDs, excessive acid production, and certain lifestyle choices, such as smoking, excessive alcohol consumption, and high stress levels, can increase the risk of developing peptic ulcers. Patients with peptic ulcers may experience various symptoms, including abdominal pain, nausea and vomiting, loss of appetite and weight loss, and gastrointestinal bleeding. As a nurse, conducting a comprehensive assessment is crucial for patients with peptic ulcers to develop an individualized care plan. Obtain a detailed medical history, including any previous diagnoses of peptic ulcers, H. pylori infection, or gastrointestinal bleeding. Assess the patient's chief complaint, such as abdominal pain, discomfort, or gastrointestinal symptoms. Ask about the onset, duration, and characteristics of the pain, such as burning, gnawing, or intermittent. Perform a physical examination, including vital signs, focusing on abdominal assessment. Assess the abdomen for tenderness, distension, or guarding. Observe the patient for signs of gastrointestinal bleeding, such as pallor, hematemesis, melena, or hematocrea. Also evaluate the patient's general appearance, nutritional status, and weight changes. Use a pain scale to assess the severity of abdominal pain and evaluate its impact on the patient's daily activities and quality of life. Ask about the location, radiation, and aggravating or alleviating factors of the pain. Determine the patient's previous and current methods of pain relief and their effectiveness. Evaluate the patient's dietary patterns, including the frequency and types of meals consumed. Assess for any dietary restrictions, food intolerances, or trigger foods that worsen symptoms. Monitor the patient's weight changes and nutritional deficiencies. Collaborate with a dietitian to assess the adequacy of the patient's nutritional intake and provide appropriate dietary recommendations. Obtain a thorough medication history, including prescription medications, over-the-counter drugs, and herbal supplements. Identify the use of NSAIDs or any other medications known to increase the risk of peptic ulcers. Inquire about the patient's adherence to prescribed medications for peptic ulcer treatment, such as proton pump inhibitors, H2 blockers, or antibiotics for H. pylori eradication. Based on the assessment findings, the following nursing diagnoses may be applicable: acute pain related to gastric irritation and ulceration. Imbalanced nutrition, less than body requirements related to altered intake, nausea, and dietary restrictions. Risk for deficient fluid volume related to gastrointestinal bleeding and decreased oral intake. Risk for impaired skin integrity related to impaired tissue perfusion and potential surgical interventions. Anxiety related to the diagnosis, uncertainty and treatment plan, and deficient knowledge regarding the condition, treatment, and self-care management. Once the nursing diagnoses are established, we can move on to the interventions. Administer prescribed pain medications as ordered and monitor their effectiveness. Teach relaxation techniques, such as deep breathing exercises, to help the patient manage pain and discomfort. Encourage the patient to report any changes in pain intensity or characteristics. Administer prescribed medications, such as proton pump inhibitors or histamine 2 receptor blockers, to reduce stomach acid production. Administer antibiotics as prescribed for H. pylori eradication. Educate the patient about the purpose, dosage, frequency, and potential side effects of each medication. Emphasize the importance of medication adherence for optimal ulcer healing. Collaborate with a dietitian to develop an appropriate diet plan for the patient. Instruct the patient to avoid foods that may irritate the stomach, such as spicy and acidic foods, alcohol, caffeine, and fatty foods. Encourage the patient to eat small, frequent meals rather than large meals to prevent gastric irritation. Educate the patient about the importance of maintaining a balanced diet, including adequate intake of fruits, vegetables, lean proteins, and whole grains, and also provide education on portion control and mindful eating to prevent overeating. Teach the patient about the common trigger factors for peptic ulcer disease, such as stress, smoking, and NSAID use. Emphasize the importance of avoiding or minimizing these triggers to prevent exacerbation of symptoms and ulcer recurrence. Provide strategies for stress management, such as relaxation techniques, exercise, and seeking social support. The final step in the nursing care plan is evaluation and follow-up. Nursing evaluation for a patient with peptic ulcer disease involves assessing the effectiveness of the nursing interventions and determining the patient's response to the implemented care plan. Assess the patient's self-reported pain levels and compare them to the initial assessment. Evaluate the effectiveness of pain medications and non-pharmacological interventions in relieving pain. Monitor any changes in the frequency, intensity, or duration of pain. Determine if the patient is adhering to the prescribed medication regimen. Assess for any side effects or adverse reactions related to the medications. Evaluate the patient's understanding of medication administration and potential drug interactions. Assess changes in the patient's dietary intake and adherence to dietary recommendations. Monitor weight changes and assess for signs of nutritional deficiencies. Evaluate the patient's knowledge and understanding of dietary modifications. Assess the patient's fluid intake and output, including urine output, and signs of dehydration. Monitor the patient's hydration status and evaluate the effectiveness of fluid management interventions. Assess for any signs of fluid overload or electrolyte imbalances. Assess the patient's understanding of the disease process, treatment plan, and self-care management. Evaluate if the patient is implementing the recommended lifestyle modifications and adhering to the prescribed treatment. Determine if any further education or clarification is needed. In conclusion, the nursing care plan for peptic ulcer disease is a crucial framework that guides nurses in providing comprehensive care to patients with this condition. By conducting thorough assessments, identifying relevant nursing diagnoses, and implementing appropriate interventions, nurses play a pivotal role in promoting healing, managing symptoms, and preventing complications. Throughout the care plan, pain management is prioritized to alleviate the patient's discomfort and enhance their overall well-being. Medication administration and education are essential components, ensuring that patients receive the appropriate medications and understand their purpose and potential side effects. Nutritional support is another vital aspect of the care plan, involving collaboration with dietitians to develop appropriate diet plans and educating patients on dietary modifications. Fluid balance management is also crucial to prevent dehydration and complications associated with fluid loss. In addition to physical care, the nursing care plan addresses the psychosocial needs of patients. Anxiety management interventions aim to reduce stress and promote emotional well-being. Education and self-care are emphasized to empower patients with knowledge and skills to manage their condition effectively. Evaluation and follow-up are essential steps to assess the effectiveness of the care plan and make necessary adjustments based on the patient's response. Regular reassessment ensures that the interventions remain appropriate and beneficial to the patient's changing needs. And that brings us to the end of our today's video. I hope you found the information helpful and informative. If you enjoyed this video, don't forget to give it a thumbs up and don't forget to sign up for a premium membership on our website, madeformedical.com, for more content like this.